Good morning and welcome to our online audience. Welcome to today's webinar where we will be discussing digital parenting support. My name is Jody van der Heide. I am a research consultant at the Justice and Violence Prevention Program at the Institute for Security Studies, and I'm also the coordinator of the Inspire Working Group. I will be chairing today's conversation for us. There are a couple of guidelines for today's event. Please keep your cameras and microphones turned off until we've reached the Q&A portion of today's event. The question and answer session will be conducted using both the chat function and the raise hand function on your Zoom application. Should you wish to raise your hand during the Q&A session, kindly click on the reactions button to access the raise hand function. Please note that we will be evaluating today's event using a poll. The poll is completely anonymous and helps us to create better events in the future. Kindly please to take a moment to complete it, and it will be launched after the presentations. As we wait for the final participants to connect their audio, we kindly remind you to please keep your microphones muted and cameras turned off until we reach the Q&A session. Kindly note that this is a public event being broadcast live on YouTube, so Chatham House rules do not apply. This year, the Institute for Security Studies, the convener of the Violence Prevention Forum, will host a series of 4 webinars to share examples of violence prevention efforts and the lessons they offer on how to build a peacer and safer South Africa. This is the second of the 4 webinars, so please be on the lookout for the remaining 2 in the next few months. The Violence Prevention Forum is a multi-sectoral platform for dialogue, knowledge sharing, and relationship building in South Africa. We are a network of more than 250 NGOs, researchers, policymakers, development partners, and the private sector, where we come together and share knowledge and research, as well as evidence-based programs, interventions that work to prevent violence. Our goal is to strengthen relationships between the sectors working to prevent violence in South Africa and to ensure that interventions, policy, and programs are evidence-informed. Of course, one of the reasons the Violence Prevention Forum was created was in response to the high levels of interpersonal violence in South Africa. And I'm sure we are all aware of these high levels of violence, and it is something that we are faced with daily. Sadly, we know that our children experience these high levels of violence as well. And there is ample evidence showing that children who are victims of violence have poorer health, employment, and educational outcomes in adulthood. They are also much more likely to perpetuate violence in adulthood. And this is why preventing violence or intervening as early as possible is critical in stopping these cycles. We also know that children are victims of violence at the hands of their parents or caregivers, the ones meant to care, raise, and nurture them. Nurturing, loving, positive, and emotional responsive parent-child relationships are the cornerstone of enabling children to develop and prosper in adulthood. And yes, parenting is hard, and all parents need support along the way. One effective way to do this that is backed by a very large body of evidence from high, middle, and low-income countries is through parenting support. Parenting support programs are one of the 7 evidence-based strategies in Inspire. This is the technical package that is designed to help reduce and prevent violence against children. Parenting programs are designed to strengthen positive parenting-child relationships and reduce the risk factors for violence and abuse. It teaches parents and caregivers non-violent forms of discipline, fosters bonding and healthy attachments, and helps to reduce parental conflict and stress management. Parenting programs are typically delivered in person, and although effective, in-person delivery can be expensive and require significant human and organizational resources to deliver it properly. We're living in a world where each day seems to become increasingly digital and technological, and so digital parenting support has emerged as an innovative way to overcome many of the challenges of in-person delivery and also to provide support at an unprecedented scale. But how do these digital programs work? What are the different kind of modalities used? What are the challenges and successes with it? We are very grateful to have 3 experts with us today who will share 3 examples of digital parenting support programs We will learn about their experiences with online delivery, adaptation, challenges, successes, and how it empowers caregivers and parents. We will be together for the next hour and a half, and we really would like this to be a discussion, and we encourage your engagement as the audience. So please feel free to pop your questions, comments, reflections in the chat box. In terms of how we will structure the conversation, each panelist will speak for about 10 to 15 minutes, and thereafter we will open up for a Q&A session with the audience. So with that, I would like to introduce our first speaker. Nicole Chetty is the project manager at Global Parenting Initiative. She has been working on ParentApp for teens since 2021, focusing on making parenting program tools easy and effective to use. She's involved in everything from testing and pilot studies to research trials, and is currently finishing an MPhil in public mental health. Nicole loves turning research into practical resources and enjoys working with different groups to help build stronger families and communities. Nicole, thank you very much, and over to you when you are ready.
Thank you, Jody. Wow, it's so great to be here. Thank you so much for having me and for allowing me this platform. Yeah, so as Jody mentioned, we are now really privileged enough to be able to prevent violence against children in new ways and looking at different ways of doing this. And I am so grateful to be able to present to you about the work that we've been doing. I will share a little bit about the Global Parenting Initiative, who we are and what we do, and then go into a case study of the project I've been working on and what we have been working on, and sharing some results from our recent randomized control trial. I am presenting on behalf of a really big team, so it's not just me, it's a huge team. And yes, so let's get started. Okay. The challenge is that more than 1 billion children are exposed to adverse childhood experiences, like violence, poverty, and inequality. And these experiences have negative consequences on child development, health, and economic outcomes. Evidence shows that parenting support interventions can reduce these experiences and can promote positive child and family outcomes. How do I make this smaller? There we go. In-person parenting programs cost hundreds of dollars per family, which is really expensive to scale in low-resource settings. Our vision at the Global Parenting Initiative is to empower parents to improve child development outcomes, reduce family violence, and promote mental health and well-being through scalable, evidence-based parenting interventions. This is aligned with the UN Sustainable Development Goals. The core principles of this organization is to create evidence of impact, to be scalable and low cost, to be open source and freely available, to be adaptive and locally relevant, for local leadership and collaboration, and to be playful and empathetic. The Global Parenting Initiative has partnered with Parenting for Lifelong Health, with the shared goal of providing evidence-based, cost-effective, scalable parenting programs to every parent everywhere. Parenting for Lifelong Health has been tested in 20 randomized control trials across the globe. You can see the countries listed there, and it has found to be effective. And we are really excited to be using PLH. A little bit more about PLH is it's been used in all these different countries across the globe. You'll see there's different types of PLH. There's PLH for parents and teens, PLH for young children, PLH for toddlers, PLH informed, and then the recent developments are Parent Text and ParentApp Online and Parent Chat, which is the shared reading online. These are all the online and remote programs that we have developed recently. So yes, we have been all over and it's been really exciting to see the impact of these. So I've shared the problem, and our solution is to create scalable, evidence-based parenting support that harnesses the power of technological innovation to reach millions of families. We've done this by creating different digital platforms. So we have PLH in person, which I've shared about. We've developed Parent Chat, which is an online support group where daily messages and structured chats are shared over messaging platforms like WhatsApp or Telegram. Then we've got Parent Text, which is an interactive chatbot that is delivered at population level through SMS, Facebook, those sort of things. And then we've got ParentApp, which is an app-based, offline accessible program for parents of adolescents and parents of kids. This is what I will be sharing a bit more about. I have been working on the ParentApp for Teens program for the last 5 years, I think. And yes, so a bit more about ParentApp. It's been through 6 years of development and testing. We started way back in 2019 where this app was co-designed and co-developed with users from 9 African countries. Um, we had an adaptation and feasibility pilot in South Africa where it was tested again for feasibility. And then in Tanzania, we also conducted a further pilot study to look at feasibility and in preparation for a larger scale randomized control trial. Between the pilot and RCT, we had an optimization trial where we optimized the app in the way that users wanted it to be optimized. One of these was changing the animations in the app from blob figures to human characters. And then we started the randomized control trial in 2023, where we worked with 4,800 participants, which we have just finished a few months ago. The Parenting for Lifelong Health that we used core content from the in-person program, and we adapted it for a digital platform with the help of Clowns Without Borders and Anna, who's on this call. They did incredible work on that. We've taken the 12 modules, made them digital and put them in the app. And during the RCT, there was some requests from people that they wanted more evidence-based sexual violence prevention content. And so we have developed that and added that into the app. We've also added content on learning through play and coping with grief and also just keeping safe online. Yeah, and so that's the content we have in the app. More about the trial. So it started in 2023 up until 2025. It was conducted in Mwanza, Tanzania, which is rural and peri-urban. We worked with 80 communities in the area where 40 communities received ParentApp and 40 communities received WashApp, which was the control app that looked at hand washing and sanitation. And yeah, we worked with 4,800 people. This was caregivers and their adolescents. We tried to include as many males as possible, and we managed to get 25% of males, which was incredible. 13 was the mean child age, and 50% of them were female. We conducted interviews at baseline and then program delivery, and then we had 1 month post-test interviews, and the final set of interviews took place at 14 months post-test. The delivery costs for this at scale was really low. So it came to around $6 per family to deliver this at scale. This includes the app maintenance, the onboarding, providing data to participants for downloading the app and using the app, facilitator data costs, facilitation, salary, oversight, and training and coaching support. Yeah, so this was the cost to deliver the app at scale. And as noted at the bottom, the startup, adaptation, translation, sustainable digital infrastructure, training, supervision costs are a bit more, dependent on the number of languages and cultural groups per country. And yes, so our results, which I think is the main part of what I wanted to share today. When it came to sexual violence victimization, we found a effective, decrease in violence victimization of 68% at 1 month and 57% at 14-month follow-up. It was highly significant for adolescent girls, which was incredible. For some reason, boys was non-significant, but overall, over boys and girls, there was a 31% reduction at 14 months post-test. This was adolescent report only, so it wasn't including caregiver report. And then sexual violence vulnerability. This is things like driving with local motorbike drivers or unwanted sexual touching. There was a reduction of 17% for girls and 18% for boys at 14 months post-intervention. Child abuse, physical abuse, verbal abuse, and neglect was highly significant for both girls and boys at 14 months. At 1 month follow-up, there was a decrease of 22%, and at 14 months, 11%, which is really incredible. And then when it came to caregiver intimate partner violence, there was a decrease of 16% with female caregivers and 6% witnessing this from an adolescent perspective. I'm moving through these really fast, but please feel free to note down questions and I would be happy to answer them at the end. There was also sustained effectiveness at 14 months post-intervention for mental health distress in both caregivers and teens. Depression was reduced by 19% for caregivers and 5% for adolescents. There was a Cohen's d 0.19% decrease in stress for parents, and then a 24% reduction in adolescent behavior problems at 14 months follow-up. When it came to parenting, there was sustained effectiveness at 14 months post-intervention for parental supervision, positive parenting, involved parenting. Parent support for education was mixed. Parents reported that there was an improvement, but adolescents reported that there wasn't. It was a slight improvement from parents, which with a Cohen's d of 0.32. And the adolescent report was non-significant. And then the one iatrogenic outcome we had was that inconsistent discipline went in the wrong direction, and we are trying to figure out why. It could be because of the measures we used. We're looking into this and we'll hopefully be able to share some more about this at some point. But yes, inconsistent discipline went the wrong way. In terms of attitudes, the effectiveness for caregivers at 14 months post-intervention was effective. It decreased by 24% and with a Cohen's d of 0.25 around caregiver attitudes to gender roles and gender equitable behaviors. There was no effect on child attitudes to gender roles. When it came to communication, there was a sustained effectiveness at 14 months post-intervention with a Cohen's d of 0.42 on caregiver-child communication, so that was also effective. With social support, there was effective Cohen's d of 0.22 and 0.14 for caregiver social support and teen social support. And then high-risk sex was also effective with a decrease of 54% risk reduction. I think it was 42% risk reduction overall, but 54% risk reduction specifically for girls, which is really phenomenal. With finances, there was a sustained effectiveness at 14 months post-intervention too. There was a decrease in financial distress, an increase in financial self-efficacy for both teens and their caregivers. And this is particularly interesting because we did not provide cash transfers to families. We only gave them this parenting intervention. One of the modules was around budgeting, and I think that was what impacted this, which was really interesting and fascinating for us to look into. These are the resources that our team has written up, and if any of you are interested in reading up a bit more, you can see it here. And please feel free to contact me. My email address is at the bottom. And thank you to all our partners and funders and everyone who worked on this project. Whew, okay, that was a lot.
Thank you so much, Nicole, for that presentation, and congrats to the team for these really amazing results. I'm sure there are a lot of comments and questions brewing, and I'm going to ask you to please hold on to them or pop them in the chat into the meantime until we get to the Q&A session. Um, so thanks very much, Nicole. I would like to introduce our second speaker, who is Karen Ross. She is the head of programs at Mikhulu Trust, where she oversees early childhood development initiatives, including the Dialogic book sharing program and Parentline. With extensive experience in education and social development, Karen is passionate about turning evidence-based research into practical tools for parents. Her work supports Mikhulu's mission to empower parents as their children's first educators, fostering a systemic, community-driven approach to ECD. Karen will be talking about Parentline. Karen, over to you when you are ready. Thank you.
Thanks, Jody. Good morning, everyone. I'm excited to share with you the story of Parentline, which is our WhatsApp-based parenting chatbot, and how it's helping parents reduce stress, strengthen relationships, and ultimately prevent violence in the home. Parentline is an initiative of SAPPIN and Mikhulu Trust and is based in South Africa. Mikhulu Trust's work focuses on strengthening families and supporting caregivers to provide responsive, nurturing care to young children, as well as tools for parents to engage in stimulating interactions with their young children. SAPPIN, which is the South African Parenting Program Implementers Network, brings together organizations from across the country to collaborate, share evidence, and advocate for parenting to be recognized as a cornerstone of violence prevention. SAPPIN's primary objective for the Parentline SA project was to develop a holistic but light touch digital support service for parents across South Africa. The project was to repurpose the existing expertise within the SAPPIN network of NPOs that currently already serve parents, families, and children. So key aspects of expertise from the different organizations was curated, redesigned, and pooled together to provide support on a holistic range of issues experienced by parents. We know that parenting is rewarding, but also deeply stressful, particularly in contexts where poverty, unemployment, and violence are part of daily life. Stress often spills over into harsh parenting, and we see the tragic impact of this in intergenerational cycles of violence. Parentline was designed with this in mind, so to reduce parental stress, to increase confidence, and to encourage positive, responsive parenting. These three elements are the foundation for violence prevention at home. So before building Parentline, we conducted research with caregivers in South Africa to understand their needs. We asked three key questions. What questions do parents ask most often? How do they use their cell phones and for what? And what would encourage them to start and keep using a digital parenting platform? And the results were very clear. WhatsApp was overwhelmingly the most accessible and familiar platform across income and literacy levels. Parents most often wanted practical guidance about child behavior, health, and stress management. And they said they would use a digital platform if it was recommended to them by someone that they trusted. They were very aware of online scams and wary to download apps or content. Additionally, we knew that 92% of households in South Africa owned a working mobile phone, and that WhatsApp worked both on feature-rich and smartphones. So that's why we chose that route for our chatbot. The next steps was from all the initial data we'd collected, we developed 4 personas, and we were aiming our content initially at those 4 personas. We've subsequently, over the last year and a half, increased that, and that we would be focusing on these initially. This was the young mother, the single battler, the young couple with minimal support, and the new dad who wants to be involved. We then went on to develop storyboards for each of the personas that informed what content we would start with and how this would be structured on the chatbot. After a soft launch, which was mostly with SAPPIN organizations, we conducted further research through 2 SAPPIN member organizations to identify additional topics that we should cover, as well as get an idea of priorities for content development, with the most pressing questions being covered first. This research involved focus groups in urban and rural areas, as well as data mining of years of data from Ububele's clinics and their Facebook and WhatsApp discussion groups, which covered the Eastern Cape, Western Cape, Gauteng, and KwaZulu-Natal. Our research showed that parents consistently ask about daily stresses, child behavior, sleep, feeding, discipline, and their own stress levels. These stress points are also risk points, and if left unaddressed, they can escalate into harsh parenting or violence in the home. Parents told us that they're most likely to use a digital platform if it is trustworthy, quick to use, practical, and feel supportive rather than judgmental. These insights shaped Parentline's design, which is menu-based, easy to navigate, responsive to parents' real challenges, and framed around positive, responsive parenting. So Parentline is a menu-based WhatsApp chatbot and is very simple to use. Caregivers add Parentline as a contact, open WhatsApp, and then just type in hi. They're welcomed and guided through registration, and once registered, they see a menu of options tailored to their child's age. At present, they can register 1 child, but we are in the process of expanding this to 3 children, which would mean that caregivers will be able to toggle between menus tailored to different age groups in their households, rather than having to go back to change the child's age at the beginning of the menu options. The menu offers them personalized, age-appropriate content from pregnancy through early childhood all the way to adolescence. We're also introducing AI tools that will help us detect potential crisis situations from parent feedback and trigger immediate referrals to specialized services, which is an important safeguard against violence and abuse. Parentline provides more than just information. It offers real support pathways. Parents can access bite-sized advice tailored to their child's age, from sleep and nutrition to emotional regulation and stress. But here's where it's truly innovative. The chatbot also uses the caregiver's postal code to identify local organizations offering parenting support. And if the user wants to talk to someone, they can break out into a WhatsApp chat with a real NGO or service provider, or they can be referred for in-person help. So it's not just digital, it's deeply connected to local trusted systems of care. Any parenting organization in South Africa is able to self-register on the chatbot, and they then vet it for authenticity and the services that they offer before going live on the system. Content is being curated and uploaded constantly. We currently cover child behavior and advice on how to deal with troubling behavior, child development, which is both physical, social, and emotional, nutrition and health, parental well-being, which will also include parents caring for their own relationships, the first 1,000 days, dealing with family changes. So for example, new homes, new sibling, divorce, new marriage, co-parenting, and single parenting. And finally, child safety, which includes safety in the home, body safety, online safety, and how to make your child feel safe again after they've experienced some form of trauma. What we're working on currently is specifically child abuse, how to recognize it, how to deal with it appropriately, and how to report it. We're also looking at things like child trafficking, cyberbullying, and additional content on online abuse and safety. At its core, Parentline is about preventing violence before it begins, by offering parents support in real time on issues that they're experiencing in the moment. We reduce stress in households. When stress is reduced, the risk of harsh or violent parenting goes down. And when positive, responsive parenting increases, children feel safe, secure, and loved. This is what breaks the cycles of violence. We currently have approximately 1,200 unique users, with the majority being mothers. We're hugely encouraged by the numbers of fathers interacting with the platform and hope to grow this as well in the future. Child behavior remains the top topic selected. However, it's closely followed by child safety, which has been added more recently, indicating a strong need for information on this topic. User rating of content remains consistently high, with an average rating of 2.83 out of 3. Feedback is especially heartening. One user said, "Thanks for encouraging me not to be tired of my baby when she is crying." Another said, "I feel empowered." Another recent user commented, "You give a valid way I can live with my son and to keep him safe for now and in the future. Thank you." These results suggest that even light touch digital tools can reduce isolation and increase parenting confidence and reduce stress levels. The age range of children for whom parents are seeking advice remains skewed at the moment for the 2 to 6-year-olds. Content for older children was added much more recently, so we expect this to grow considerably over the remainder of this year. We're proud to now have users in all 9 of South Africa's provinces. Word of mouth is being used to encourage use, as we know from our initial research that the chatbot is far more likely to be used if a trusted source recommends it. All SAPPIN members are promoting it in all of their engagements with parents, and we have also included it in the training that Mikhulu Trust is doing with community health workers in the Western Cape. And they're finding it particularly valuable on their home visits to be able to advise parents on issues that they may be facing. All parenting groups who sign up to the chatbot as referral partners will also be promoting its use to their beneficiaries. So we're expecting growth to increase exponentially over the next year. Our vision is a national gateway to confident, connected parenting. To scale, we need 4 things: national awareness campaigns, which we're planning via clinics, ECD centers, and schools in their interaction with parents, and an expanded referral network supported by technology, including AI to flag crises, constantly updated, relevant, and tested content, covering topics parents need information on, and most importantly, funding to be able to pay the necessary subscriptions, which increase as user numbers grow, and then to continue to add functionality as technology develops. If we succeed, every caregiver in South Africa could access trusted, culturally relevant support that reduces stress, encourages responsive parenting, and prevents violence. Parentline is not just another parenting app. It's a bridge between digital and real-world support, co-created with South African parents, rooted in local communities, and built on trust. Our goal is to ensure every parent feels confident and connected wherever they are, reducing stress, strengthening caregiver-child relationships, and preventing violence. Thank you. If you'd like to learn more or be a referral partner, please get hold of us. We would love to hear from you. Thank you very much. Back to you, Jody.
Thank you so much, Karen. This really is brilliant, and thank you for sharing this work. The one thing that I am noticing between the first 2 presentations, although it wasn't said explicitly, but how, a parent's own stress levels and mental state really affects how one parents. It's not only about your relationship with the child. If you are going through a stressful period, or you're having conflict with your partner, that will inevitably affect your parenting, and your child can see that. And so it's not just about the parent-child relationship, but also managing parental stress, emotional regulation of the parent or the caregiver is equally important. So thank you for highlighting that. Moving right along, I would like to introduce our final speaker before we open up for the Q&A. I see there's already a lot of engagement in the chat, which is great. So it is my pleasure to introduce Anna Boy, who is the Head of Content Solutions at Clowns Without Borders South Africa, where she leads the development and adaptation of in-person, digital, and blended parenting interventions, including the Sinevuyo Parenting for Lifelong Health programs. With 15 years of experience, she collaborates with families, government, NGOs, and academic partners to co-create content and tools that enable effective delivery and scale up of support to parents and families. Anna, thank you very much, and over to you when you are ready.
Thank you so much, and good morning, everyone. It is a real pleasure to be in this webinar. Thank you for making the time. Let me just share my slides. Are my slides visible?
Not yet.
Yeah.
Not yet, Anna. It's probably just taking a second or two. Okay, it's loading. Perfect, we can see it.
Yeah. Wonderful. Good. Thank you so much. So today it is my pleasure to share a bit about the experience of Clowns Without Borders South Africa. Just like my colleagues, we're part of many wider networks, and the digital work that we're doing is not at all something that we have accomplished, but something that we've been privileged to be a part of. So today I would love to share with you a bit about our learnings from adapting and preparing this digital parenting support for scale. In the various projects that we've worked on, including the ParentApp project that Nicole was sharing about. So Clowns Without Borders South Africa was established in 2007, and since that time we have been increasingly involved in the parenting field in collaboration with Parenting for Lifelong Health and the Sinovuyo programs that many of you might know from the South Africa context. At Clowns Without Borders, we work on the adaptation of these parenting programs, on capacity building in the communities, and we provide scaling support as well. So over the years, we've worked with over 60 partners in 25 countries, but South Africa has always been our home, and that's where our heart is. So in South Africa, we've worked with the Sinovuyo Teens program for parents and caregivers of children ages 10 to 17, as well as the Young Children program for parents of children ages 2 to 9. And where we started with in-person delivery, with in-person group-based programs, we increasingly became involved in the digital interventions. And we realized that a blended approach, just like Corin was sharing, is a very helpful one, where we're not only offering parenting support in the digital or the online space, but also connected to people's real life experiences and connecting it to real life service delivery, because parents are navigating so many things that need a range of support, and not only the online support that they can get through these interventions. In the programs that we worked on, we all know that we are offering universal skills and principles, but it's not a one size fits all. So we can't offer a single type of parenting intervention and assume that will work across the different contexts, across the different target groups that we're working with. So based on all these different types of experiences, we've learned a lot of lessons around adapting parenting support, and also around how we can use the opportunities of digital interventions to help reach more parents and provide them with the support that they need. So that is one of the main advantages of the digital interventions, the fact that we're able to respond more flexibly to adaptation needs. So, of course, what we all know from our context is that there are ever-shifting needs among families, among new target populations. The service delivery structures have certain requirements. There are changes in policies and guidelines that we want to incorporate in the interventions that we offer. And there's ongoing research that's happening that is telling us what works and what doesn't work, and what kind of new skills we can offer to families to support both violence prevention, family strengthening, and all the related outcomes. So with the digital interventions, we're actually able to respond to these different shifting needs better, because we used to have only hard copy printed parenting manuals. We would train facilitators, they would go and deliver the program. And if anything needed to change, we need to go back to the drawing board, rewrite content, and bring that back into our program rollouts. But with the digital intervention, that changes into a click of a button. We change things in a mobile application, we change things in a chatbot flow, and suddenly we can offer new content that's really up to date and responding to what's needed on the ground. So we're able to offer both a tailored and a tiered way of offering parenting interventions. This connects to the different interventions that Nicole was already sharing from the Global Parenting Initiative and Parenting for Lifelong Health side. So we have on the right the in-person programs that we know and love that are offered in a group-based setting, but now we're able to widen the range of services that we can offer to parents. So we're able to offer digital-only support where parents can download an app or engage with the chatbot at a very low cost of almost less than $1 per family. Then we have online groups, the third option, where we offer a group-based setting, WhatsApp chats to families where they can interact with each other and a facilitator and learn new parenting skills that way. And then the second option, the blended option, is where we see most opportunity. So there we see we're offering these digital scalable solutions to families, but alongside that, we also offer an in-person component and live support that really gives that peer support and that guidance that is needed to both ensure that families are actively engaging with the digital intervention and also receiving the support that they need to navigate any challenges that might come up. And again, you see the cost difference from the different cost analysis research that our partners have done, that these blended approaches were able to offer that at around $6 per family, where we do have that connection of having digital interventions with online and live support. So if we look at these blended approaches where we connect the digital and the real world, if you like, there are various opportunities that we can highlight. First of all, the digital interventions are low data and they remain free for users. So the various interventions that Nicole presented, they are freely available for any user to download or engage with. And we always try to ensure that these interventions are low data, so people can choose to either interact with text only, they can opt into videos or audios, and that way we can really tailor to the needs of the users. And these digital interventions really reduce the HR and delivery cost. So that speaks to my previous slide, where now at a fraction of the cost, we can offer parenting support, and that also facilitates integration into services, because we all know that the service delivery structures in South Africa and beyond are very strained. There's not much time and capacity and resources available to go around. So by blending the approaches and offering digital content in the mix, we're now able to reach more parents through the existing service delivery structures. Also, we've standardized the infrastructure of the digital interventions and ensured they're open source. So in that way, we have really created a platform of developing new content and new interventions for families at a fraction of the cost, because a lot of the development work has already been done. We have standardized authoring structures for new app content, for new chatbot content. So whenever new needs arise, new topics come in, we can respond to that because the main big investment has already been made and the groundwork has been laid. And that allows us to integrate global learning into local deployments. So again, if we see from research, from global learning, from institutions providing new guidelines, we can integrate that into any local intervention as well. And we can deploy that new content to existing users with the click of a button. No need to go back to the printers. So over the past few years, we have been working and we are still working to respond to those emergent trends and integrate new topics in the digital content that we have created over the years. We've been working on online safety, on male engagement, on early childhood development. We've integrated content on learning through play. We're currently working on developing an adaptation for adolescent parents to also support them in their specific situation. We've created content for the prevention of sexual violence to support parents and teenagers on sexual and reproductive health, on mental health, and many more. Again, the opportunities are endless because it has become so easy to deploy new content. And of course, with the digital interventions, just like with the in-person interventions, we need to make sure that we connect to local realities. So we make sure that the visuals that are there in the mobile applications, in the chatbots, are representative of what people experience. So here you see an example of some visuals from Mexico, from Kuwait, from South Africa. And based on the context, we can adapt those visuals so people can recognize themselves, because we know that this works so well. If people recognize themselves in the programs that are offered, they're more likely to relate to the learning points that are brought across. We change the character names, so the grandmother becomes a Gogo, and Claire becomes Fundiswa. And again, that helps people to relate that this is something for their local reality, something that they can try in their context. We update concepts, role play scenarios, comic scenarios. We make sure that the facilitator looks like someone from the community. And we also facilitate the translation processes. So just like with the in-person program, the digital interventions can also be translated, and it has become more easy because of the translation platforms that are available. So again, we're relying on our amazing tech partners for that, where they've been able to facilitate a translation process that has become really easy. So as soon as we deploy in a new context or a new language, if the app needs to be made available in isiXhosa or isiZulu, that becomes very, very feasible. But of course, it's not all easy. Venturing into this digital space comes with its own challenges. And one of the first ones is, of course, digital literacy and smartphone and internet availability. So not every user will be accustomed to using a smartphone, using an app, using a chatbot. So there's some additional support that's needed there. And that's also where the blended approaches come in again, that as you're doing an onboarding session, you can help users navigate any challenges that they might have, and that can be tailored to the needs of the users. The fact that we have as low data as possible interventions helps, of course, with the internet usage, with the storage capacity on people's phones, but it's still a challenge that we need to navigate. Another major drawback of the digital interventions is that there is limited human interaction and referral support. So we love seeing what Mikhulu Trust and SAPPIN are doing with Parentline, that there's that link back to in-person referral services and making sure that people receive the support that is needed and that is so valuable. Of course, the development of digital interventions is a time-consuming process. Over the past 6 years, I've been enjoying that process almost full time. So I know that it takes a lot of time and effort from a very wide team of partners, both in terms of tech development, contextualization, design. There's so many components that come into it. And sometimes the outputs that we create are non-replicable. So we've only learned over the years, the hard way, that it's really important to standardize structures so that whatever you're creating can also be replicated in other contexts, so that there's not that you can do that once-off investment to create programs that are usable in other contexts and for other target groups as well. And then a major challenge that we're also still trying to figure out is how to ensure sustainability. So of course, there are ongoing product hosting, product maintenance cost. The app needs to live somewhere. The chatbot needs to be kept online somehow. So it's really an ongoing process of ensuring that the right stakeholders are involved, that the products live with the right people, the right institutions, the right government departments, to make sure that whatever we're creating remains available to the people we hope to support. And of course, as everything is new, there's always going to be unanticipated effects. There's going to be risks of the new approaches and the platforms that we use. We have seen there are challenges if we base an entire intervention on WhatsApp and something changes in WhatsApp's agreements with with relevant institutions, then suddenly the intervention might not be available anymore. So those kind of risks are really real, and I think it's really valuable to explore alternatives and to see how we can make sure that what we're creating remains available. So I think all those challenges really emphasize the need for really close collaborations within the parenting field and beyond. And there needs to be that co-design and iteration of the digital interventions with both the intended users and the implementers, where who we hope will adopt these interventions and host them in the long run. So I'd love to close off with just a few of the exciting opportunities that are coming up. So at Clowns Without Borders South Africa and with our wider network of partners, we're currently working on a South Africa contextualization of Sinovoyo app. So the application that Nicole was presenting about that was proven to be so effective in Tanzania in the trial. We're bringing that back to South Africa, contextualizing it, translating it to the various local languages. So that's in the works at the moment. We're working on the co-design of online safety content, because we all know the online world is just getting bigger and bigger, and our children are exposed to so many new risks and so many new opportunities in the online space. So we also want to equip parents on how to help their children navigate that space well. We're always working on strengthening male engagement and equal norms. So within traditional parenting programs, we've always seen that it can be challenging to ensure male engagement in those interventions. There are some advantages to the digital interventions, of course, in terms of easy access and less barriers for male caregivers to participate, but we need to tailor things more and make sure that we get the results that we're looking for there. Like I already mentioned, we're developing content to support adolescent parents, both in their relationship with their young children, as well as the relationship with their own parents and their wider extended family. And we're also exploring the use of generative AI to see what role AI can play to provide tailored support to the specific challenges that caregivers might have in their parenting journey. So if any of these topics sparks your interest, make sure to reach out to me. Like I said, it's so important that we have the right stakeholders on board in any of the things that we developed, in any of the processes that we engage in. So we're very open to your ideas and your input there. So you can reach out on my email address here at the bottom, and a big thank you to our funders and partners as well. This is not something that we do by ourselves at all, and we're really grateful to be part of this network to really see how we can reach more parents with the support that they need.
Thank you so much, Anna, for that really amazing presentation. And thank you for also highlighting some of the challenges in this work, because we know that as much as it's exciting and innovative and has a lot of potential, there are challenges that come along with it. So thank you so much for that. I see a lot of engagement in the chat, which is exciting. So thank you to all three of our speakers, and thank you for all being perfectly on time. I would now like to invite the audience for our Q&A session. Please feel free to raise your hand, unmute yourself. We would love to see you, so you are welcome to turn on your video to ask your question or your comment. Otherwise, please pop your questions in the chat. I have seen our speakers have been responding to a lot of the questions emerging in the chat, so thank you very much for that. So yes, let's open up for any questions from the audience. Please feel free to raise your hand. Lots of great feedback in the chat for everybody. I see a hand from Monaco. Please go ahead and ask your question.
Hi everyone. Yeah, it feels so good to be part of this session. You're hearing me twice. I would like to know about the ParentApp. Is it only available in English? Because we are serving communities in rural areas. So I would like to know if maybe are you working on that, or what's gonna happen? But above all, I loved the presentations and we have learned a lot.
Thank you so
Thank
much
you
for
so much.
that question.
Thank you, Monaco. Can I respond to that?
Absolutely.
So In South Africa, at the moment, excitedly, we have just completed the translation of ParentApp into isiXhosa. So I'm hoping that the rural communities that you're referring to might happen to be in the Eastern Cape. If not, we are looking to expand into further translations. Like I said, with the digital interventions, it has become more easy to translate the interventions and make them available in different languages. Interestingly, a randomized controlled trial around one of the other digital interventions, Parent Text in South Africa, did show that a lot of users preferred to work with the English intervention, even if a translation in isiZulu, Afrikaans, or isiXhosa was available. So even when we think that people would prefer to work with local languages, there is also that learning that we saw that a lot of users opted into the English version over the local translated one. Of course, that might relate to local dialects and different kind of things, but that learning is also there.
Thanks very much, Anna. Any other questions from our online audience?
Thank you so much, Anna and this team. We are very appreciated for your presentations and how the details you have been given to us. I hope this lesson is very much important for our children and preventing for digital issues. My question is, what are the main spectacles that can be prevent the children to be used the digital, as they are almost interesting to watch the small videos of the cartoonists, and they cannot be prevent. In the house, they are, when you turn off the screen, they turn on. And when it comes the time of the school, they don't want to go to school, and if they want and come back to have lessons to the house, they did not read. We are very complicated about the digital in learning education of the children. So what are the basic essentials that we are prevent from them to be active for their learners and prevent for digital issues?
I think that was Abdi. Thank you very much for the question. Is it directed to a specific panelist who you would like to answer that question?
No, the presenter, Jana, Anna, and the people who can give to us some ideas.
Thanks, Abdi. Anna, go ahead. Did you get the question?
I struggle a little bit to understand it, but I'll respond as best as I can, and then you can guide more, Ali, to see if I responded. But what I'm hearing you say is that there are different challenges also in engaging in education. So what I can say there is that with the digital platforms that we have created, all of that infrastructure, if you like, is open source. So my technical colleagues will be able to tell you a lot more about this. But we have all the I don't even know if you call it software or hardware, but all the programming that has happened to offer these mobile apps and chatbot interventions, that's all open source. So that infrastructure can be used by anyone to develop their own interventions as well. So if you are speaking into specific needs in your context, specific challenges that you're seeing, and new content you would like to offer to either parents or teens as they navigate their realities, you can use the infrastructure that our teams have built for that.
Thank you very much. And Abdi, did that answer your question? Okay, I think that answered.
Yes. Absolutely. Of course, that was my question. Because of the topic was preventing, supporting online, and some digital technologies.
Yes, thank you so much. I see Bakele's hand and then Sinatamba after that. Please go ahead.
Okay, you can hear me?
Yes, loud and clear.
Okay, thank you for your nice topic bring for us, all presenters and also organizers. I want to say thank you for your presenting for us such important things for our community, our the countries, especially as general. My question, I have only one question. This is important the topics. So how we can cooperate and working on this topic, all of us together in each areas.
Thank you very much. Do you mean is your question about how you can get a digital intervention in your community or in
Yeah,
the work that you do in your organization?
yeah.
And I think it's similar to your previous question about the open source information.
Okay. And yeah, maybe in addition, I think our learning is really that contextualization is so important, right? So if in your specific context, you know the ins and outs of what is happening. So we'd love to collaborate with you to see how our interventions could support in your specific context and support you as you adapt and contextualize, localize the content that we have available and see how we can really tailor it to what is needed on the ground.
Thanks, Anna. And please note that if you have further questions, you are more than welcome to also either email me or email our panelists today if you want to take this further. Sinatemba, go ahead with your question.
Right. Good morning, guys. Mine is more like a comment than a question. Great presentation by both speakers, though. I wanted to say I'm glad that the app also have a closer translation, because where we are right now, we're working mostly with people who cannot really understand or speak English fluently. So most of them, they understand Xhosa, and they are in deep rural areas. So I'm so happy about that. And also, I think there are many trainings maybe that are needed for them to understand the app, because it's not more like a WhatsApp where I text and you respond at the same time. So there are a lot of information and a lot of things that they can discover. So yeah, as I've said, mine is more like a comment. So I'm glad and I'm happy to be here. This was great presentation by you, Anna, and Nicole. Thanks, guys.
Thank you so much for the feedback. And yes, the capacity building and the translation issue is really something that's quite important to consider in the development of these apps. This is our evaluation poll that has just popped up. Please take a second or two to complete it. It should take less than 30 seconds. This helps us to learn more about who you are and helps us to create better events in the future. Any other questions or comments from the audience? Just a note that the recording of this event will be available immediately after on the same page that you signed up for, as well as the presentations that were shared. So you will have access to this information afterwards as well. Any other questions?
Hi, yes, my name's Catherine. Sorry, I've got a bit of a cold at the moment.
No problem, Catherine, go ahead.
Dialing in from Ingenie, an EdTech acceleration program and think tank based in Cape Town. And yeah, thanks so much to all the speakers today. Really, really interesting content. Mine's like a bit of a methodological question that I think any of the speakers, might be able to answer. But in conducting, focus groups to understand the feasibility of the various digital platforms and understanding sort of barriers and enablers to adoption, on average, what is sort of the recommended number of people to speak to, whether that be in focus group discussions or key informant interviews, to get a good sense of how the tool is being received and what the enablers and constraints might be. So interested to find that out from whoever would like to comment.
Thank you very much, Catherine. That's a good question. I wonder if Karen, go ahead.
Yeah, for us, it's important to do focus groups regularly. So we built that into our way of developing content, testing it, and ensuring that it is relevant, and also just making sure that we have a spread of areas that we cover in terms of our focus group. So we look at rural, we look at peri-urban, we look at cities, and then also we're trying to get focus groups in other provinces as well. So far we've done focus groups in KZN, Western Cape and Gauteng, but we haven't done them in any of the other provinces. So that's something for us. But in terms of a research, it probably is a different situation. But for us, where we're not actually just doing research, we've been building the chatbot. We make sure that we do focus groups often because we need that feedback in order to ensure that the content is relevant and is useful.
Thanks, Karen. For
Thanks.
that.
Yeah, thanks so much, Karen.
Nicole, do you have anything from the
Yeah.
ParentApp side?
I can also add that we have done, I think we've conducted quite a few focus groups, just like with different groups of people at different stages throughout the study. When we needed to create new content, we had Jonathan, who's on this call, he conducted focus groups with some parents in South Africa to develop new content. When we first launched the app, we had no idea what people would think of it and if it would work at all, if anyone would like it. And so we had people from 9 different African countries come together and we conducted in-depth interviews with all of them. So I think it was more like, that wasn't so much a focus group, but it was more one-on-one interviews with people, just asking questions about how they experience it, what we could do better. One of our colleagues, Isang, conducted those interviews and she did user testing with so many people. And I think our pilot, the main aim of the pilot that we conducted in Tanzania was basically to see the feasibility. And we did that with 100 people. But that took a lot of effort. It was a lot of, I think that pilot was probably more work than the RCT. Even though it was just 100 people, I think the planning for that and like the interviews and getting feedback, it was really quite a process. So I'm not sure if I can answer your question on how many people. I think at some point you reach data saturation and people are saying the same things about the same stuff. Like one of the things I mentioned was people didn't like the cartoon images, or we had like faceless, or they had faces, but we had like blob people characters that weren't man or woman or anything. They were just like blue blobs and people didn't like that and it came out a lot. And so like that was one of the things that came out from many people through different conversations, focus groups, through feedback we received in interviews and things like that. Yeah, so I think not a specific answer on how many people, sorry.
No, so helpful. Thank you. Thanks so much. Super interesting, and to Karen as well. I guess what I'm hearing is it could be about the frequency is important, and in Karen's case with Parentline, and then in your case, I guess the very in-depth nature of the focus group is important too, and then obviously the wide representation of people. But 100, that's a large amount. Well done.
And if I can just add one point, I think it's also the iteration that's really important in our experience. So sometimes it can be hard for caregivers or families to imagine what these digital interventions would look like, right? So you consult them at the start and ask what they want, then you produce something, take it back to them and see if you got it right or not. So I think that speaks to what Nicole was saying, that this pilot was really important. But that can, of course, be done in different formats in subsequent co-design workshops or whatever that looks like. But I think that iterative process of getting input, creating something, getting feedback, changing it again, changing it again, changing it again until you get it right. I think that's where you really can add a lot of value in what you're offering.
Thanks so much, Anna. Thank you.
Thanks, Catherine, for that question. Any other questions popping up for you as this conversation is going? Senzekile, go ahead.
Thanks, Jody, and thank you and well done to the speakers. I'll show my face. Morning, everyone. So I have 3 questions, and the last question is actually a question from one of the participants who couldn't actually attend the event, so she sent through her question. So the first 2 that I would like to ask, and apologies if I missed it in the presentation. So it's around just sort of participation and engagement, especially with the PLH programs that are adapted into sort of online. Like, what is sort of the completion rates? Do people go through all of the sessions? How does that work? Because I know sometimes with in-person parenting programs, one of the concerns is, will people actually be able to commit to all of the sessions? So just curious to see how that changes with online. And then the second question is just around kind of getting a sense of, as the different organizations have been using these online platforms, what story are they telling around the challenges that parents are facing? I think one of the beauties of online is that we get access to way more data than actually we could maybe in person. So it can start to build a story of what are we learning about parenting challenges, which I think, Karen, you began to speak to, but I'll be curious to hear even from Nicole and Anna, just what is the story that's emerging around the challenges of parenting, or maybe even how they're shifting. And then the question from the participant who couldn't be here, she was sharing just some of the challenges that she has observed and faces in the programs that she offers with parents, and how cultural norms or cultural beliefs. So, for example, in South Africa, there is something called intlawulo, where if you have a child out of wedlock, your partner might need to pay a certain amount or do a ceremony to show respect to the family. And that can have huge impacts in terms of fathers being able to have access to their children or engage with their children. And they've seen how certain cultural practices can actually cause so much stress and harm to the parent. And they just wanted to know, to what extent can online parenting supports address some of the challenges around, cultural beliefs, cultural norms, and where are they maybe sort of like limitations of such apps? Yeah. Thanks to the speakers, and thanks, Jody.
Thank you very much, Senzi. Those are great questions. I think let me open up to the panel and respond to any of the 3 questions that were asked. So I think maybe, Karen, if we can start with you.
Oh, thanks. Yeah, the whole thing about cultural beliefs and the gatekeeping that happens is something that we're really aware of, and we make sure that the content that we're providing is culturally relevant. So we're aware of it. We know that sometimes prevents parents from being fully involved. And I think it's about being sensitive to that, but at the same time stressing that a child needs both parents in their lives. We are hoping to be able to add an aspect to the chatbot at some stage where people can address those types of questions directly. Currently, we have a trigger when we do get a comment in that we can then reply within 24 hours, giving advice. But one has to do it sensitively.
Mm.
So yeah, cultural awareness in the content is really, really important. In terms of what we're learning about parents and what their needs are, on the Parentline, we've got the ability for parents to be able to comment, giving us an idea of what content they would like to see. They can also rate the content that they have accessed and are able to comment on it. And we go through that regularly. We take that into account a great deal in terms of what content we're going to move on to next or going to add to the chatbot. In terms of what parents are most interested in, so online safety is a big thing at the moment. It's one of the most recent blocks of content that we've added, and we've just seen parents accessing it hugely to the point where it's the second most accessed part of the chatbot. So only child behavior beats it at the moment. So we're expecting that to grow enormously. I think parents are very concerned about that. And that for us was very interesting, that was something that parents want to know more about.
Mm.
I'm not
Thank
too
you.
sure if I answered all of the questions.
You did. Thank you so much, Karen. And now, Nicole, any responses to those 3 questions from Senzi?
Yeah, I can share a little bit about the participation and engagement in ParentApp. Thank you, Sensi, for the questions. I think they're really great. So I think in our study, in the RCT specifically, there was really fantastic engagement. It was actually quite a surprise to us to see that the engagement was so high up until the end of the RCT. There were 12 modules, and I think by the time we got to the 12th module, we had expected most parents to have dropped off or not being completing anymore, but we had an average of 81% of parents complete all 12 modules and still choose to remain in the WhatsApp groups after the intervention had ended. And so I think parents really enjoyed the content and even asked for more in their follow-up interviews. And they really loved, I mean, I think from what I've heard from parents is that they really love being part of their WhatsApp groups and forming like that sense of community. I'm in some of the WhatsApp groups and they still talk to each other. Like there's still messages in those WhatsApp groups and it's been 3 years. So I think parents really loved engaging with each other and participating with each other. I think that was a huge part of why engagement was so high, because parents were there to like support each other, and that sense of social support was there. Yeah, and even once we released the new modules, which happened after the RCT, and so this was not facilitated support at all, parents still completed the modules. I think there was like a 50% access, or 50% of participants looked at the modules without facilitated support, which is really mind-blowing that parents just open the app because they want to learn. So I think participation and engagement was quite high and really unexpected. In terms of cultural norms and beliefs, I think I echo what Karen was saying, that it's really important to include people in the culture and in the context when creating the content. So like when we developed the content, we worked closely with people who live in the area, who understand the cultural norms and beliefs, and they could guide us through what was the right, like what we could write, like when parents come home in Tanzania, they don't drink a cup of coffee. No, they go wash their face. Or, like these things that we put in the app, but we don't know. And so I think it was really important, even things as simple as in the design, where we had put a girl in school clothes, but her skirt was above her knee. And this is not allowed in Tanzania. The skirt has to be below the knee, so these small little things that came up are things that we learned from the people who live in the community. And I think what helped is we worked with a local team who knew the area, who know the people that we worked with, and they could provide really detailed support on doing that. Anna, I don't know if you want to add anything.
Yeah, I think, thank you, Senzi, for the questions. I think this really speaks again to the importance of having that blended approach. So by offering only online support or only digital support, you're likely to miss the mark because there's too much complexity that comes in. We did a quick test in the network that we're part of in Tanzania to only deploy ParentApp and see what happens if you offer it without onboarding, without WhatsApp groups, just plain app. And then we saw that completion and engagement really dropped very, very steeply. So there was a lot of interest, a lot of people downloading it, great. But then only 10% completed the first module. Whereas when we implemented it in the blended format that Nicole presented with WhatsApp support groups, and then we see really ongoing engagements up to the point that when then additional modules are released only as app-based modules, they still see a higher completion rate. So it's interesting to see that. I think that's a really important learning. And I think that also speaks into how to take into account cultural practices and norms. I think the human component really allows for that flexibility to address those points more carefully. When we do in-person onboarding sessions now, as we're considering male engagement and how to work with equal norms, we're exploring if we can include activities where parents reflect on their own upbringing and how the division of tasks was in their own home when they were growing up. So those kind of human interactions allow space for those more sensitive topics to be addressed, to set people up for a win as they engage with the further ParentApp content. In terms of what we're learning in terms of what parents want and what kind of challenges they have, I'm with Karen there. The online safety is a really important one. And the digital interventions that we work with are all modular, so people can choose what they want to engage with first. So I think that really helps provide that tailored approach as well, that people feel like their first needs are being responded to, and they're not being forced into a process that doesn't match to what they really need. So I think that's beautiful to see. And again, the WhatsApp groups allow for that space where there's a facilitator who asks about what are people's challenges. So around the parenting topic of that week, there's an open space of, well, how did that go and what are the things that you're coming up against? And the group problem solves together. So again, there's that joint space where whatever is relevant for the parents right now gets addressed through the blended approaches.
Thank you very much, Anna and Nicole. Those are really excellent responses. I see one more hand. I am watching the time. We have a few more minutes left. Sabeth Papela, your hand is up. Please go ahead.
Yes, good morning, and thank you so much for this nice presentation to all of you, and for you for driving this. Yeah, it is like heart touching. I would like to know, because I think I'm falling in love with what is being presented here. I'm working in 3 different spaces with both moms and children. I work in hospitals, working like I see staff members. Sometimes with them, I'm a counselor anyway. I'm a pastoral counselor. When we have a conversation, I do come across that the problem is not much about what is happening in the workplace, but it's rather from home. Maybe a mother or a father is like not getting like whatever respect, or they are not content by the way things happen at home. So they carry that with them when they come to work. So that's one space. At school, again, as a school counselor, when I take history of the children, it's a primary school, aggressive children, bullies, sometimes those who are like isolated. When you take the history, you find that back at home, there is a problem. It's either the parents do not understand the kid, or the kid, like there's that thing. So now that's why I'm listening attentively in what we are saying with your app, with your like this online app. So I'm falling in love as a pastor again. Yeah, I'm working with mothers, parents who have questions, even though some of the things I do like mix them in my sermons at sometimes, but I just need something that will address the problems. Like in your case, in the online app, if I can know if they can speak after I've asked questions, what do you like to have this thing addressed? What do you think of it? So such things for me, yeah, I don't know how to put it correctly, but in the three spaces that I'm working in, I feel like I need this app, I need these lessons.
Absolutely. Thank you for sharing that. And it sounds, from your question, it sounds like you are really looking for like practical guidance to be able to
Yes,
offer
yes,
to
yeah.
parents and teachers and the children. And I think that's what these apps are really trying to focus on, is practical tips to deal with all these challenges and situations that come up with parenting.
Yes.
So I would recommend that you can share the Parentline with the parents and teachers that you work with. I think that is a great first step for them to use on WhatsApp. I think,
Okay.
Karen, if you could maybe speak a little bit about how does someone get Parentline on their phone? I think you mentioned it a bit, but if you could maybe
Okay.
speak to that a little bit.
Yeah, it's really easy. So all you need to do is add the Parentline number as a contact on your phone, and that number is 087 813 4290. And then you would just open up WhatsApp, find it as a contact, and just type in hi. You then register, specifying whether you're a mom, a dad, a caregiver, what age your child is that you're looking for advice on. And then you engage with the menu. And it's very much, the advice is personalized in terms of the age of the child. We are adding the functionality that you can have three different age children, and the app will automatically age them as you continue to use it as well, and update the menu so that you're getting information that's relevant all the time. And then you just engage with it. It's available 24/7, 365. And if you're not finding the content that you're wanting on there, please comment. We look at those comments, we take them seriously, and we develop content based on what people are wanting and needing.
Thank you very much, Karen. If I could please ask Karen if you could pop the SAPPIN link about Parentline in the chat as well. I know there's a webpage on the SAPPIN website as
Yeah.
well. I know we have 2
Will do.
minutes left. Thanks, Karen. Nicole, can I just ask for the ParentApp? Is it still in the testing phase, or is it something that is, like launched and available for people to use, or we're not yet at that point?
It's launched and available in Tanzania, not quite in South Africa yet, but we're working on it. And I think Anna's part of the team developing the new one that will be launched, I think, in September or at some point
That's
soon.
right. That's right. So for ParentApp South Africa, we have a web-based version that's in this team. You're welcome to check out and provide input on as well. So I'll put that link in the chat as well. And then very soon the app will be launched in the Play Store for anybody to download as well.
That is fantastic news. Please let us know when that when that happens. We would love to share
Definitely.
far and widely. We have come to the end of today's event. Thank you very, very much to our 3 speakers. Your work is excellent and important, and thank you so much for sharing and taking the time to speak to us about it. Thank you to the audience for really great engagement and positive feedback in the chat to our speakers. You know, this work that we do to prevent violence and work with children and parents in this country and across Africa is really, really important for our future. So please feel free to get in contact with me if you would like further information. The recording will be available on the ISS website, and please be on the lookout for the future VPF webinars that will be held towards the end of this year. Thank you very much, everybody, and have a wonderful day further.